It is my honor to introduce the first speaker, Dr. Didier Demassosso. Didier Demassosso is a clinical psychologist, a mental health advocate, and public health mental health expert in Cameroon. His advocacy for better mental health facilities and resources have landed him many recognitions in Cameroon and at the international level. As a mental health leadership and advocacy program alumni of the WHO, the World Health Organization, Didier serves on multiple committees for general and mental health. He is a representative coordinator for the Healthcare Information for All HIFA in the African region and the Cameroon representative coordinator for the WHO. As a Mental Health Innovation Network Knowledge Exchange Assistant and Masse World Mental Health Specialist for Africa, Didier works with the Center for Research and Training in Mental Health in African Nations, the Department of Psychiatry in Cameroon, and the University of Ibadan in Nigeria. Please welcome Dr. Didier Demassosso.
Hello, everyone. It's evening here. I'm calling from Cameroon. Now it's 5 p.m. I'm really excited to be here. Thank you so much for the brilliant introduction. Without wasting a lot of time, we're going to jump directly into the talk, if you permit me. Great. This is a special event because we have to discuss. I'm talking about discussing. That is why I will not do a presentation in a formal way. I will basically discuss with the audience, with you all, and the discussion has to do with mental health. We want to talk about mental health. We want to talk about mental health stigma. We want to talk about awareness. We want to talk about child and adolescent and youth mental health. To start with, mental health is the state of well-being whereby an individual is capable of coping with the normal stress of life. They are capable of realizing their potential and they're capable of working productively for themselves and their community. Whereas mental illness is a situation whereby an individual's ways of thinking, feeling, and doing or acting are dysfunctional. Everyone has a mental health, and our mental health determines how we feel, how we walk, how we think. That is why it is so important. And the mental health of young people is a critical issue that we need to consider because young people are the future. Young people are the persons who are going to be the adults of tomorrow. That is why talking about their mental health is really, really essential. And having to focus on this is really important because they, most of the time, have the inability to express themselves as adults. Thereby, they suffer in silence. That is why child and adolescent and youth mental health in general is very important. When we talk about children, we talk about individuals which are less than 10. When we talk about adolescents, we're talking about people aged between 10 to 19. And when we talk about young people, generally, we're talking about people aged between 15 to 25 or 10 to 24, depending on international standards. So mental health is indeed a state of well-being. It should not be confused with mental illness, which is a state of ill-being, a dysfunctioning of our ways of thinking, feeling, and doing things. So mental health stigma is a national and international or global problem because mental health stigma affects people living with a lived experience of mental illness. And when we look globally, for instance, the Lancet Commission for Mental Health Stigma has really pointed out that it's a global phenomenon affecting all countries. And now, when we go further in African countries, or Cameroon specifically, where mental health development is poor or little, we realize that indeed there is much more stigma as a result of inequalities pertaining to the development of mental health vis-a-vis physical health, because generally in African countries, there has been for decades tremendous development in physical health, but mental has been relegated to the second place. So people living with a mental condition are generally stigmatized, discriminated, and they feel marginalized. Normally, this causes a lot of problems in their mental outcomes. As a matter of fact, for the past years, mental awareness has really improved globally. And I think the COVID-19 has really enabled many people to be aware that mental health is something they have to take into account. In fact, the WHO, the UN, and many other UN systems have put forward that the COVID-19 created a global mental crisis. This is really important to do because it's the COVID which has really shaped our understanding and the need to really take mental health seriously. So, in African countries like Cameroon, mental awareness has really also been improving for the past years, but it is still insufficient. And persons living with mental conditions, especially children, adolescents, and young people, still face discrimination. In fact, there is a gradual and persistent idea that children, young people, adolescents don't have problems. Mothers or adults generally will say, why do you think you have problems? I'm the one working, I'm the one doing this for you. Which type of problem do you have? It's a consistent idea which is being perpetuated in communities around Africa in general and Cameroon in specifically, where the idea of a child or adolescent having a mental condition is totally unbelievable. It's not even thought of. So this is causing a lot of problem now in trying to enable the children, the adolescents to seek help. Because in fact, the key element affecting or what mental stigma does is that it prevents people who have a mental condition to seek for help. Whereas this help is essential, especially when it is done early. It is essential and it contributes greatly to improving the mental outcomes of the persons when the treatment is done. So because of mental stigma, the individuals who have a mental condition, especially the young children, don't receive the help which they need. And now, let's talk about the state of children, adolescents, and young people globally and with respect to mental health. Statistics show that 1 out of 6 young people, that is the WHO statistic, UNICEF statistics show that 1 out of 6 young people is affected by a mental condition, basically depression, anxiety, and behavioral disorders. And that self-harm is something which is affecting young people, and that death by suicide is the leading cause of mortality of people aged 15 to 24. And disability caused by depression, anxiety, and behavioral disorder is real, and it is really affecting their capacity to learn, their capacity to work or to be productive generally. And this increased with the COVID. For instance, in the United States, these are statistics of the Mental Health America report. It says that about 2.2 million young people are presently living with depression, and that there is a percentage of about 16% of young people. These are statistics of 2023. 16% of young people are affected by mental health conditions. For Africa, as a result of issues with data, it is not always very possible to have specific data. But nonetheless, there is the Blue Mind Foundation, which did some interesting study in 2021, and they found out that in Francophone Africa, because Africa has several countries which speak several languages. So for Francophone Africa, the Blue Mind Foundation in 2021 found that the mental health index, or the state at which young people feel, is very poor, is 0.4, with about 80% of Africans living in Francophone countries, especially the young people, saying that they have a mental health condition. And the COVID has been one of the elicitor or the trigger in the process. So generally around the world, be it in Europe as well, there's an issue of mental health affecting young people. You see, youth mental health crisis is real. It's a reality. So the problem now is that there is a shortage of resources to take care of young people, because initially young people themselves, because of their immaturity, adolescence in itself is a transition from childhood to adulthood. Children themselves are immature by essence, so they cannot easily express their needs. So there is now, because of the fact that young people themselves don't even express their needs, there is generally a shortage of specialists who are going to be focused on trying to solve the problem of young people. So it's really a problem. It's really a problem. Nonetheless, there is a lot of work worldwide which is trying to raise awareness on the problem. For instance, is just to name what recently happened in the United States with the U.S. surgeon who raised awareness on the fact that youth mental health crisis is a problem. In Cameroon as well, recently, the Ministry of Public Health has risen awareness on the fact that young people consumption of drug is not good. It's not good for them. So there is growing awareness globally that young people's mental health is key. And there has been, therefore, specific interventions which have been developed. What has been shown to be very effective is school-based intervention, because young people pass a lot of time in schools, and being in communities, the fact they pass a lot of time in schools themselves can be health promoting spaces. The schools could enable them, and in fact that is a principle that the WHO has put forward, the principle of health promoting schools, whereby through specific programs young people can learn or improve on their mental literacy skills. Or in fact, schools can serve the purpose of enabling young people to be safe, or to develop competencies, psychological competencies, or mental health competencies, or mental health skills necessary to be resilient, necessary to affront life. So there has been several initiatives which have been put forward, not just awareness, and school-based interventions have proven to be very fruitful. And in Cameroon, just to mention the interventions which have been put forward, we have, for instance, a project. I was chanced to be part of this project. It was called PROME, promoting mental health among young people. In the project, we trained school counselors. We had peer support groups for adolescents. We enabled them to develop or to learn how to manage depression through learning coping skills, and we improved their resilience through teaching them things like psychological first aid, because the project was based in the Southwest region, which is a humanitarian context. So the idea was to enable the young people. They could not press a button to end the war or the crisis which is ongoing, but they could learn how to be stronger, how to be more resilient. So we improved on their mental capacity through education. And this has really proven to really help, especially that generally in Africa, or in Cameroon in general, the mental health treatment gap is very low. That is, there are too few health professionals for many persons needing mental care services. So school-based interventions are really working, and the WHO and other UN systems like UNICEF. In fact, recently there's a document called the EASE, which has been launched. I think it's 2020 this year, which enables now again, still in the line of empowering young people who are in distress to learn how to cope with stress. So this joint document, WHO, UNICEF, is something which we are learning because it's a new training which we are learning now to be really effective on the ground. Okay, looks like there is a question. Well,
Yes, you have a question. It's from Mr. Paul in
yes, please.
okay. He asked, how do you detect and diagnose mental health in Cameroon, especially in rural areas?
Thank you very much for the question. Cameroon is a low middle income countries with a population of about 30 million persons. The mental health development in Cameroon is very slow, but for the past 10 years, a lot of things has been happening. Basically, all the mental health services are located in the big towns, Douala, Yaoundé, at the big major towns. However, some of the services are also distributed around the other eight regions because Cameroon has 10 regions. So unfortunately, there's inequity in the distribution of healthcare services or mental health care services because most services are focused in the big towns. And this is really a real problem because it is affecting quality of life of persons who are in the rural areas, and this is also affecting in a long run the quality of the data, which is even very scarce because basically most of the data which we know or the mental profile of Cameroon which we know comes basically from the hospitals which are based or found in the urban area. So it can be very difficult to really appraise what is happening in the rural area. So that is the situation in Cameroon. Nonetheless, there are very few local organizations who go. I know just one, but it's just to tell you that there is something which is done, but even though it is very insufficient, but there are some local organizations who try to go into these remote areas to provide the services in this rural area. And also the stigma in the rural area is also very high because the awareness there is not also very, very high. There's a lot of superstition. They still confuse mental health to be madness, mental illnesses to be witchcraft. For instance, epilepsy, which is a neurological condition in some places of Cameroon, is considered like witchcraft. Epilepsy, which is a purely neurological, untreatable condition, it's considered as witchcraft. Unfortunately, this affects the persons who are in need of care. So there is a huge need to provide mental care services in rural areas in Cameroon. Okay, so thank you very much for the question. So we're talking about from awareness to action. So there's a lot of awareness which has been going on, as I said, globally with the COVID and even in Cameroon, a lot of awareness has been going on to the point whereby many people now know about mental health. It's even in the parlance, the way people talk. You go on social media, when you look at how people talk on social media, you're going to see them talking about mental health. In the news, in newspapers. In fact, for the past 10 years, there has really been awareness. But unfortunately, even if the actions which are being done, they are very insufficient. And generally, they're not targeted to support children and young people. Unfortunately, even if Cameroon has a mental health policy, which is which has a priority acts of focusing on young people, the interventions specifically for young people or children and adolescents doesn't really exist. It is really insufficient and poor, making it very difficult now for young people to really access mental health care information, which is necessary for them to take informed mental health care decisions. So there is really need to invest in child, adolescent, youth, and mental health. Because as we certainly know, children become adolescents, adolescents become adults. And because adolescents or being a youth is a risk factor for the onset of many mental illnesses. It's very important to focus on that period. In fact, research shows that about 50% of all mental illnesses start before the age of 14, and about 75 start before the age of 25. So the period of adolescence is critical in supporting adults' mental, because when an adolescent has not received the necessary support, the necessary care when they were adolescent, obviously they're going to become a sick adolescent, a sick adult rather. And unfortunately, the adolescents of today, the children of today, are witnessing things adolescents or children 10 years ago, 50 years ago were not witnessing. For instance, climate change. In Africa, climate change is affecting people. Heat, floods. Actually, in Cameroon, the far north is totally flooded. The young people are not going to school. In the extreme north of Cameroon, because of the floods, actually, young people are not going to school. And it's everywhere. Global warming, climate change is affecting young people. Heat. Some research by WHO has also shown that heat is affecting young babies, affecting their mental. So these things that children are experiencing now, these things that adolescents are experiencing now are new, because 50 years ago, 100 years ago, this issue of climate change was not as pronounced as now. So there is real need, therefore, to invest in child and adolescent and youth mental, because it's a way to ensure that the generations of adults who are going to come are capable of working fruitfully and productively. Thank you very much for your kind attention.